Bismillahirrahmanirrahim. Assalamu alaikum. Today I'm going to discuss how to fill the course information form for HCPC. So first of all, let's open the course information form. This is the form. It is a two-pager form that we have to fill for HCPC. So this is the course information form, and if you are applying for HCPC registration, you have to fill this form for all the degrees that you are using to get registered. For example, if you have done graduation, you have to fill this form for graduation separately, and for post graduation and whatsoever, for DPT, for MS, for DPharmacy, for nursing, whatever is your degree, you have to fill one form for one degree. Okay, so first of all, it is very important to understand how you are going to fill this form. Most of the institutions today, they are offering a filled form, but I recommend you to please double check it, and it is better to fill your form yourself and then you may proceed. It's not very difficult thing. For this you need this form, and you need your curriculum or syllabus. Here we have two syllabus. This is the syllabus of or the curriculum of Doctor of Physical Therapy that was revised in 2016, and here is the curriculum of Doctor of Physical Therapy that was revised in 2010 to 2011. So you will see a date over here. So you must know that when you were doing graduation, which curriculum was being followed, okay, because there can be a disparity. Okay, how to fill this form? Name of the applicant, let's write my name, for example, Sayyid Ali Hussain, and name of the institution. For example, I graduated from Rawalpindi Medical College, Institute of Allied Health Sciences, Rawalpindi Medical College. So let's write Institute of Allied Health Sciences, Rawalpindi Medical College. Okay. Then here will be the address. For example, the address will be Rawalpindi Medical College, Tipu Road, Rawalpindi, Pakistan. The email of the person who is responsible for responding your queries or the queries of HCPC. So the email of the head of the department. For example, let's take any HOD underscore AHS at the rate of blah 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 blah. Okay, so here should be the email, and this email should be working, and this is the same email to which the HCPC will email about your confirmation. Okay, here you should write telephone number +92, or you may write 009251 dash blah 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 blah. Okay. And then you must mention the degree. For example, right now this form is filled for the degree of Doctor of Physical Therapy. This is the date when your course started, so this date should be accurate. For example, 8/8/2008, or when your course completed, let's make it 10/8/2013. These dates are very important because these dates will be cross verified. The HCPC will ask your principal or the person whose email you mentioned over here. They will email this guy and they will ask that please tell us about Sayyid Ali Hussain, what was the degree title he did, and when did the course started, when did the course ended, and whether there was any criminal background for this student or this guy or not. Okay, and this should be signed and stamped by the head of department or the principal. Now this page is very important because this is the first page and you have to print the first page. You have to print the first page and the very last page. I am repeating this, that you have to print the first page, this one, get it signed and stamped and then scan it, and the last page you have to get the sign and stamp, or just the stamp is even enough on the last page, and then you can scan it. So what about the pages that are in between? They needs to be converted into PDF in the soft form. You don't need to print all the form and then attach it. Okay, so just page number 1, first page, and the last page. Okay, how we are going to expand this is very important. So let's go to this. For example, this degree was 5 years. If somebody has done 4-year degree, he or she is going to remove this 5. So let's talk about course year. It will be first. In the first year, here you must talk about subject, descriptive title of the subject, session, theme, or module name. For example, semester number 1. So this semester needs to be along with here, for example, semester number 1. Let's remove this first. So semester number 1, we can remove the italic and even clear this. Semester 1, let's go and see what is the first subject in your curriculum. We will scroll simply. So this is the subject, anatomy 1, and let's go to the detailed description of anatomy 1. Here it is. So we are going to copy all of this, copy, and we are going to paste it. Okay, but we are not done yet. So these are also contents. Let's copy these also. Copy, enter, or let's start from here. Copy and paste. It is very important to please pay attention to all the things that I am doing, and it is being finished till here. So it's a very long subject, as you can see. So let's copy these, copy, and copy and paste, and keep your formatting corrected. So this is the first subject that we entered in the first semester. Okay, anatomy 1. After that, you have to add the anatomy 2. Here should be, for example, you need to go down all the way. You have to enter, press enter like this. Or even you can just simply click. So you have to bring it down all the way. So just go down by pressing enter. And here we are going to enter the second subject, which is the physiology. So it will be the same for physiology 1 that you have to copy all the things, for example till here. So the procedure will be the same. I'm just showing you that now we have entered 2 subjects, for example, and Similarly, you can add all the subjects. You just have to change, let's say from here, if you want to go to the next year, you will go here, and in the next column you will, let's assume here you will talk about second year, or maybe third or fourth semester, something like that. Or here you should talk about third year, fourth year, and similarly you can go for final year. So you can just add these tabs if you want. It's not very difficult, it's very easy, but there is a technical thing attached, and let me show you what it is. So these are very important. Assessment methods: verbal, written, and practical. You have to add these assessment methods. That what were the assessment methods? Were they verbal, written, or practical? If there was Viva involved, you may talk about verbal. If there was written involved, you may talk about written. And if there was practical involved, you may write P. Whether this exam was undertaken at your institution, yes, okay, you must I believe all the times you have to write it yes. And one more thing before you can add these things, you have to talk about the assessment criterias. So I will open the other form to save time, and I'll show you how it is done. So here you can see I have mentioned the assessment plan below the course contents and recommended books. Okay, so the assessment plan was that there was internal assessment that had assignments or quizzes or classes or tests. You have to clear the formatting as well. The assignments were only having 10% marks. So then you can mention the midterm examination, the final examination, and Viva, whatsoever the marks. So then you need to mention the theory paper, the duration of the paper, number of MCQs, right, dot, and type was MCQs, marks 100, pass fail criteria, 50% cumulative, and everything like this. Or there is this, that the theory marks was 90, internal assessment was 10 marks, 5 marks in each subject, and total marks 100, pass marks, because this is a bit different. So you have to follow this, and even the written examination method is also mentioned. This is important. Now where we can find this? This is very easy to find, and this is very easy to be seen, and you can find this in your curriculum. Let's go and try to search for the examination. Control F and examination. So let's see the examination. What is the examination system and what is the examination criteria? These criterias are important. For example, here we know one thing, that we had a subject 3 credit hours, 2 is theoretical and 1 is practical. So this is important to understand, that what is meant by 2 and what is meant by 1. And again, how your examination was done, you can find this in your mark sheets, you can find this in your transcripts, and you can also ask this from your university, and you know this, what was the exam or what was the system. So here I am unable to find it here because maybe there is a different nomenclature, but let's go for clock hours. If I can see it, it's not very difficult, but you have to just search it. Here is the description of the theory and practical lab hours. So you sometime have to mention this, so keep this in your mind. And what is meant by the clinical or research hours, everything is mentioned. The total credit hours can be seen over here and mentioned. So there should be no disparity between the credit hours that are mentioned here and on your transcript and in the course information form. Okay, so this is important for us to understand and remember. So if there is any assessment or examination criteria mentioned over here, we may find it, or the clinical hours and course hours. So let's see if we can get these, or maybe let me pause it and find it, and then I'll start the video. So I was unable to search that information. in the DPT curriculum. So for this you have to either ask your university or you have to do the maths yourself. It's not very difficult, but it is a bit technical, so you have to just calculate your hours. For example, I have opened another curriculum I had. So in this, for example, first year you have these hours and total marks and everything is mentioned. So for this, for example, if the clinical practice was for 4 hours in the second year, then you can add this in the third year for 500, and similarly in the final year or fourth year of this BS program. So all the values, all the numbers, all the figures needs to be accurate, and it should be the real one, and there should be no disparity in between. So if you can see over here, so you have mentioned this, and lastly you have to just mention yes or no in front of this. Undertake at this institution, whether you took or studied this in this institution where they mentioned it. So yes or no, you can just write this, and you have to fill this HCPC form, course information form, for every degree like this. I know it is a bit long video and it is a bit difficult to do it, but even if you get your course information form from your university, please double check it. Please make sure that there is no disparity in the clinical hours, in the clock hours, in the assessment methods and things like that. This is very important, because most of the students, when they send this or when they try to get registered for HCPC, they have some problems with this course information form. And I'm only talking about the physical therapy community. I believe there are other professionals, even a lot of my friends from other professions, they are also applying for HCPC registration. So this is valid and true for even MBBS, for BDS, for any healthcare professional that wants to get registered with HCPC. So this is sort of a gift from my side to all of you. Please keep your questions in the comment section, and you can post there, because last time when I told you you can contact me easily, there are a lot of people who have contacted me, but sometimes I don't feel comfortable with the questions, the sort of questions they ask especially, and most importantly, they think that as if I have an obligation to respond them immediately as soon as they text me. So please be patient and respect others, and please take care of this thing that sometimes I'm busy, sometimes I'm not answering my phone because I have other things to do. So please, I hope you understand this, and if you can, it would be really nice if you can post your questions in the comment section, so it would be really easy. So I hope you enjoyed this video, and this is very easy for you to understand. This is all I can say today. So thank you very much. Stay blessed, and once you get registered, remember the fact that if I'm helping you, you don't have to help me back, or you don't have to support me, but please help others to make this world a better place. Thank you very much.